everyone. My name is Erin Gleason. I worked with Nadira and Dana together through Purdue University Northwest to try and see how pet therapy plays an impact on the mental health of the elderly. So in this case, we considered elderly as being 65 and older, just to help have a set guideline to follow here. But the problem is, oftentimes as people get older, they experience a decline in mental health because they're experiencing a lot of hardship. Around them, they're seeing more friends and family dying as they're getting older and everyone around them gets older. They may be having a loss of quality of life from reduced mobility or more dependence on others when they were used to previously being independent when they were younger. A lot of time they deal with loneliness as loved ones pass on, and they feel like they're limited to staying in their house for those who deal with limited mobility or incontinence or a multitude of other issues. So with all these things playing together, it's very often that you find elderly people who are suffering from anxiety, depression, loneliness, other mental health issues. And a lot of times, the most traditional approach is a pharmacological means. And that's not bad, and I'm not dismissing that. However, it is worth looking into alternatives or things that would work concurrently with drugs, drug prescriptions, to really set people up for success and give them the best opportunity possible to help their mental health and live a satisfactory and fulfilling life even as they're aging. So our whole PICO question was focused exactly on that, is how can this pet therapy affect the mental health of elderly compared to those who aren't using pet therapy, and that would be just traditional means. The most common change we saw when comparing those with pet therapy who didn't, when looking at the literature, was a general decrease in anxiety and depression. So those were the big key factors, and that's wonderful because those are so incredibly common that we found this pet therapy really benefited people in this aspect. We also saw improved sleep, improved cardiovascular health, better self-esteem, more confidence, a lot of different positive findings throughout the literature. So overall, it did support our original hunch here. We went in assuming that pet therapy would play a benefit. We didn't know how exactly at the time or to what extent. However, it was proven effective by going through many, many studies. This therapy, when you use it with other traditional means of treatment, like I mentioned earlier, prescription drugs, there's also talk therapy. When you're pairing this up with other treatments, it can really increase the quality of life and improve overall mental health for elderly people. So this is something I really push for with implementation. A lot of places don't do pet therapy just because dogs are the most common therapy animals. But of course, any animal, therapy animals, dogs traditionally aren't in a medical setting. You don't traditionally go to a hospital and you find a therapy dog or a therapy horse, anything of that nature. You don't typically see them around. And that's something that we need to try and push for. Now that we have proof, and this is evidence-based practice, we can help recommend or help support ideas of people who are trying to get that into play. So this has been a great benefit for a lot of people, and we just really need to see this expand more because right now it's been very limited. So that is my biggest recommendation, is just trying to work on the expansion here. But other than expanding, all you can do right now is just educate, educate, educate. So I hope you learned something today, and hopefully we can get this spread around more. Thank you.